When I do OT evaluations in school, I still always at least try to do a parent interview, and here's why. Number one, just because the service is in school does not mean that the parent should not be involved. They should be involved in every part of the process, including the evaluation, treatment, and discharge when it is the time. Getting a medical history is so great for a therapist to know because, yes, they can treat without it, but also it can give a lot of good information. So, for example, children who are born via C-section versus natural birth may present with different things. Children who skip milestones like crawling often have difficulty with reflex integration, which is something that an OT can work on. Knowing if the child ever had like an eye surgery, eye problems, asking if they have glasses, that's so important because vision affects all parts of the OT evaluation pretty much. And obviously, like, asking about any other medical events, like knowing their anatomy, if they have anything else going on, like their diagnosis. I always ask for a diagnosis. It's not required, but knowing if a child has autism, for example, can give the therapist a better idea of how to treat them, even though we always look at children as individuals. For OT in particular, I always ask about self-care tasks, especially if it's a child who just started preschool or is starting preschool. I really want to know how they're doing with their fork and spoon, with their cup. Can they pull up and pull down their pants? Or are they still toilet training? Those are all things that we can look at and address in terms of school. I also will explain to the parent after the interview, after I ask all my questions, if they have any questions for me, because I want to be a resource to them always. And then I will explain the process of what's going to happen next. If you're a therapist and you agree or disagree, let me know in the comments below. If you're a parent, please ask me any questions.